This is Neil Osterweil with Elsevier Oncology. I'm speaking with Dr. Matthew Katz from Saints Medical Center in Lowell, Massachusetts, regarding a very interesting study being presented at ASTRO 2008. Dr. Katz, could you summarize, please, the study for us?
Sure. We conducted a study that consisted of basically doing a literature review and looking at articles that tried to estimate the likelihood of prostate cancer spreading outside of the prostate or the outcomes after treatment, either surgery or radiation. And after looking through a variety of articles, took 21 of them, embedded them in a Microsoft Excel spreadsheet so that we could then take an individual patient's data and enter their age, biopsy information, PSA score, and their clinical stage, and then that would then give individualized information about the likelihood of disease spread and treatment outcomes after surgery and radiation. And the purpose of designing this was so that doctors can sit down with a patient and give them individual information that applies directly to him, rather than more general information that may or may not be as precise.
There are several different, as I'm sure you're aware, several different prostate cancer decision management tools out there available on the web, some for free, some for pay. Do you think that by combining these data that you'll have a more accurate or a more patient-specific method of helping patients and physicians make those decisions?
Well, that's our hope. I think, if you look at one model or another, they're designed different statistically, and they may incorporate different patient populations. So, for example, the Memorial Sloan Kettering nomograms are very precise, and they apply very well to patients in an academic setting. But not all factors are included that are clinically relevant. So there are other models that include other factors that may be important. And if you look at population-based data, it may be a little bit different. So we're not trying to find necessarily the single most precise example, but give people a sense of the range of results, because there is uncertainty regardless of whether you use one estimate or another. When it applies to any one person, the likelihood of something happening is either 100% or 0. We're trying to come up with estimates that give people some guidance, though, about what works best for them and what makes them most comfortable with how to cope with a prostate cancer diagnosis and how to decide about treatment.
Thank you, Dr. Katz.
My pleasure.
Thanks, it was great.